moving right into the next presentation, I'm pleased to introduce Ms. Lillian Kerubo and Mr. Elvis Muriithi. So this is actually a two-in-one presentation. So I'm going to give the floor to both of them to give us their presentation as well.
All right. Thank you, Julia, for this time. So as introduced, my name is Lillian Kerubo. I work for the National TB Program, and I'm responsible for coordinating active case finding activities, chest X-ray, and quality improvement. And so today we are going to share on integration of TIBULIMS and CAD4TB and get to learn the lessons from our country, Kenya. And so I will start off by mentioning on the introduction of the new projects in our country following the guidance from WHO on the use of the new tools. And so for this implementation, we were supported through USAID and Stop TB Partnership, so that we are able to implement the three projects. That is the digital adherence technology, TIBULIMS, lab diagnostics, TPT, and digital chest X-ray. So I will quickly allow my colleague to do the presentation, given that we have 15 minutes to share our experience. So I would want to ask Elvis to take over and present our lessons learned in our country. Thank you, Elvis.
Thank you, Lillian. Thank you, Julia. And thank you, everyone who has logged into this call. Allow me to take you through the integration process of TIBULIMS and CAD4TB that we implemented here in Kenya. I understand that we were the first country to do the integration with CAD4TB with our local LMIS. Just to introduce the LMIS, it's called TIBULIMS. It's more of a diagnostic connectivity system, which connects the gene experts, the TrueNut, and now we have the CAD4TB on board. So this system is now 10 years old. We started with gene expert previously, and as my colleagues said that through the support of the USAID and Stop TB, we saw the introduction of the new tools, whereby the TrueNut came on board, and now the CAD4TB, that was in 2021 and 2022. And I'll ask the tech team to go to the next slide, please. So the NTP started in July 2021, and through after this, we saw now the creation of the CAD4TB, or the chest X-ray subcommittee formed. That was in August and September. And mid last year, around May, we saw now the arrival of the CAD4TB machines. And in Kenya now, we started with the hiring of the radiographers, and of course, training them to make sure that they meet the required threshold to do these images and all. In July, the launch and distribution of these machines to the various facilities was done. And through that time, of course, we have gone to the radiation assessment to make sure that our health facilities are up to the task to handle this machine, and of course, to make sure that our healthcare workers are protected from the radiation. So TIBULIMS connectivity officially was launched in December 2022. And of course, going to the next slide, please. We went through a process of, just to make sure that you are ready for the integration. So when we started this, when we launched the machines to the facilities, we saw that there were a few gaps because, and these gaps basically came in terms of data. There's that there are those variables that we wanted to measure and collect at the ground before or during the use of these machines. So we saw that the CAD4TB machines had a software that was pre-installed, and this software was used now to collect information, but it was not adequate enough for programming. Therefore, we saw that we needed now to go off the Tirona software that is used under the CAD4TB module to make sure that we capture more variables going forward. And that's where the thought of integrating it with our local solution, which is TIBULIMS, now came in thought. So again, we saw that these machines also were remotely accessed. Therefore, we had that the need to have this information accessed remotely, or rather within a general system whereby wherever you are, you can log into the system and access information from the various CAD boxes at the national or even at the county at the county level. So this system was standalone, therefore we needed to do an integration with the TIBU system to make sure that information is available real time within a click of a few buttons. So going next. So just to mention that from the gaps now we thought now we needed to plan, and the process now indicates what we did now to make sure that we fully incorporated everything that we needed before now we can do the integration with our local solution. So the first thing we started was to identify the variables that we needed to capture. Therefore, within this, we saw that we brought on board various cadres. We have the radiologists, we have the radiographers who are running the images, and we have the clinical team, whereby we saw that we needed information of the triage. You needed to measure the BPs of this patient. You needed to see the temperature indicated within each and every patient that is taken an image. And therefore, this is besides the patient demographics, of course, the age, the gender, the sex of this patient. Therefore, we did identify these MND variables, and now we went on to develop what we call a business requirement document for this, for the new module of to incorporate the CAD4TB component of it. Therefore, after interacting with the Delft team, we saw that they have an API gateway. Of course, this is a big plus for the company and the machines, whereby within this API, you can exchange information from the boxes to any system that is available. So we talked with the ICT team under the Delft company, and we are able to get a way forward, and now we can exchange this data. So within the same process between August and before we did the rollout, we also made sure that we had the various views under the end users. Therefore, these views now will incorporate the new variables that we've identified within the MND framework to make sure that we collect as much information as we can for the patient just within the image. Therefore, with these views, now we are able to get dashboards at the end of the day, and which is one of our greatest achievements for this system. And of course, the reports in terms of line lists, which I'll just talk about it later. So within the system that we used to use, remember it was incorporating only the Gene Expert, but now the new tools are here. We needed to have more allocation in terms of the cloud capacity to host these systems. Remember, it's a web system, therefore the hosting and all the resources needed to make sure that you can access the system were put in place and in consideration, and these were all put in place in the facilities, did the proper testing, and of course for this particular solution, we did the pilot to make sure that it suits our needs, and of course did the configuration of the devices just before the rollout. So just before the rollout, again, we called all these cadres that we are talking about, the radiographers, the radiologists, make sure that they understand the system. You remember, there's a new solution, therefore you have to sensitize them to make sure that it suits their needs, and as per what we call the scoping, after the requirements that we are capturing before the BRD, to make sure that whatever they say that they want, now it's available to them. So that's where now the capacity building came in place, and now as we talk, as am I talking, we give that continuous support to the facilities. Next, please. So this is basically a model of what TIBULIMS is. So we have the site, we have the facilities where these devices are placed, and so I talked about the Gene Expert, the TrueNut, the CAD4TB. So the lowest CADA, or let me say the first end user is, of course, the clinician, or what we call the radiographer, the person who sees the patient. So, and that's where the primary data capture happens. So behind the scenes now we have the various APIs. Remember, these are systems that have their own systems that are running independently. So with the help of APIs, application programming interfaces that we've created for the Gene Expert, the TrueNut, and now the CAD4TB, which is the main topic today. The API runs in the background and make sure that whatever images run is now uploaded into the TIBULIMS database. And this now, once this information is available, all these CADAs towards the end, the users now are able to access and see the information as per the user rights given within the system. So the idea now of having this system, you can just click next, kindly, Ian. So the idea was now to expand the connectivity of the current TB diagnostics to make sure that the instruments that we have at the ground are able to be networked. We can make easy provision for easy integration for the future, and to, of course, to make sure that in terms of network management and relay of results is optimal, and within, just when an image is taken, results are uploading into the server, and within the TIBULIMS now, with various CADA can receive these results in real time. And of course, the mandate for this, of course, is to make sure that there is that easy monitoring of the performance of the instruments, and we can get whatever information that we need to get within the system within a click of a button. Next, please. So let me talk about the API. So as I said, Delft have a cloud repository for all the boxes. So what happens is that through this API, whenever there is internet connectivity to the box, any image that has never been uploaded into the system is now pushed into the server. And the various CADAs, you saw in the gap, one of the gap was that, and one of our wish as a country was to have the radiologist who is not sitting within the facility able to access these images and they can give an radiological report in real time to make sure that we give the best, with the goal of making sure that we give the patient the best service in a timely manner. So one of the reasons for this is to, of course, to reduce the time a patient comes into the facility. Remember, some of them come from far away. Therefore, we want this patient to get the best care in the shortest possible time, minimizing what we call the catastrophic cost going to the patient. So within now the system, we were able now, by system I mean TIBULIMS, we're able to have the different end user modules whereby we collect the patient demographic at large. And then there's what we call the screening data. Therefore, by screening data, I mean, we were assessing the cardinal signs for TB. For example, we want to know if this patient has had a cough, if there's the fever, if there's night sweats for this patient. And of course, we want to get the triage data. We want to measure the BP, blood pressure. We want to see what is the respiratory rate for this patient. So all this information is collected prior to taking the images. So once this information is saved into the TIBULIMS, now through the API, we get now the X-ray images and the CAD scores for this respective patient. So at the end of the day, we have a data set with the patient demographic, the screening history of this patient, the triage information of this patient, and of course now the images that have been taken. So this, as I mentioned earlier, the box, as long as this box is connected to the internet and image has never been uploaded, it is pushed into the server, and we are now able to have like a complete data set of one patient. So this of course happens in real time, and as long as now the internet is available, and based on now the various the alerts, once we get the information going to the server based on the CAD score. So based on the CAD score, the radiologists are able to assess the images and give a report to it. So just something I never mentioned is that in Kenya, we work with the threshold of 40, CAD score of 40 and above has to be assessed by a radiologist. So, and we saw that it's not a big percentage. In Kenya, it's around 15% of our data, of our patients who have been taken the images do have this the score of more than 40. Next, please. Okay, so this is basically a diagrammatic representation of a setup on the ground where we have the CAD boxes. Of course, there's the digital X-ray, we check the image. Of course, there's the laptop. So we write on the laptop to access TIBULIMS. So the laptop that is provided by Delft to provide the image is the one that they use now to access the online system TIBULIMS, where they key in the patient information. And of course, once they take the image now, we have now the cloud setup with the Delft and the API, which now pushes the images to TIBULIMS, and we have that complete data set of the patient. Next, please. So what have you achieved with the TIBULIMS system, or just from the integration with the CAD4TB? We've seen that the images and the AI reports are accessible within a click of a button from wherever you are, and therefore a radiologist is able to give the best radiological report based on the history of the patient that we collect, the screening questions, the triage information that we have, and of course later on now within the system now we've been able to incorporate the aspect of feeding in the result of the laboratory, whereby anybody with a CAD score above 40 is now subjected to a DST test, either a gene expert or a TrueNut. Once the results are out, within the same system now, the result can be updated, and we can actually ascertain that anybody now going through, or anybody who is presumptive of TB and as a suggestive X-ray or as a CAD score of above 40 can be confirmed that with a bacteriological test, which is now the gene expert and or even the TrueNut. So we see now the turnaround time on reporting going down, because if an image is not clear and a CAD score is very suggestive, the radiologist can ask for repeat images or even additional clinical information or history from the radiographer through the system. And of importance now is to get at a glance, the status of the machines. So at any given time, we can see which machine is offline. There's a days offline. If you can all see the images that are the graph that is the bar graph, we can see the 8. Sorry, I didn't mention that we have 8, but yes, we can see the uptime of these devices by just opening the dashboard. And we can see the trends of this, the images that have been taken over time. So this is the data for 2023. You can see, the zigzag, whereby we have the highs and lows in terms of screening and taking basically the patient that have been screened using the X-ray, you can be able to see this by just logging into the system and seeing this information. And again, the reports are now available in form of what we call CSV, where if you need to do more analysis to the data, you can be able to do that. So the colorful batches just show the number of images that have been taken. Out of this, how many have a CAD score of above 60? How many have a CAD score between 40 and 59.99? And those are that are below 40%. So from this, we can see a picture of our screening or our images that have been taken. And at a glance, you can see like 15% of 2023 data. We can see that they have a high likelihood of having TB because of the CAD score, which is above 40. So going to the next slide, please. So what we've learned from this project or this integration is that engaging our stakeholders is very important, because for you to get a successful system, a system that works for us, or a solution that works for us, you need to engage every stakeholder to make sure that you meet their needs before you implement such a case. So support and real-time response from manufacturers is also very important, because many a times we've seen our boxes, fail, but good thing with such a mechanism in place where the manufacturer has a help desk is very important. And in this case, Delft help us in a long way, because the help desk is always open in case we have our users at the ground or at the facility level. Having any challenge, they are resolved within no time. So continuous training and refresher to the end users is very important to ensure that the mandate that is in front of them is able and the solution is working. Therefore, support mapping of available, the strength that we can improve on, just to ensure that this kind of support is going and it's continuous, to make sure that they don't follow the track to in case of any challenge that any challenge that may arise. So again, and a very important one is to ensure that in the dynamic area of this field of TB, where we have new molecular diagnosis of devices coming up, it is important to prioritize now the issue of integration to make sure that the solutions that are creating, we can be able to integrate with the current system to make sure that, sorry for that. Sorry for that background noise. I'm in a hospital setup for some technical assistant, as I was saying. So just on the last point, to make sure that the solutions that are coming up are easy to integrate with, to ensure that the data that is run on these devices can be uploaded into our systems, to ensure that there's that our reports are available by click of the buttons, and just to make sure that our analysis are adequate enough. Sorry for that again. So moving to the last part, I think that sums up to the end of the presentation, and it's unfortunate that the last part was interrupted by some background noise. So as I finish, I want to acknowledge of course, the Ministry of Health, which has, through the various programs like the National TB Program, whereby we want to acknowledge the leadership, the head of the program, Dr. Immaculate Kature, for allowing us to make this presentation and supporting us through all this. Of course, we can't forget our partners in this, the USAID and the Stop TB Partnership, TBAC and CHS and PEPFAR for the funds and support towards ending TB in Kenya. So back to you, Chair. And thank you so much for listening to me. Yeah, much appreciated.